Hello guys, today we'll be talking about tuberculosis and we'll be talking about tuberculosis under the following headings: introduction, causative agents, pathogenesis, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is tuberculosis? Tuberculosis is a chronic infectious disease that majorly affects the lungs, but can also affect organs and systems of the body in cases of extrapulmonary tuberculosis. Tuberculosis is one of the oldest, as well as one of the most persistent infectious diseases known to mankind. Archaeological evidences suggest the presence of tuberculosis lesions in Egyptian mummies. Despite increase in modern medicine in contemporary times, tuberculosis still remains of global public health importance, especially in low and middle income countries of the world. Tuberculosis is majorly caused by Mycobacterium tuberculosis, a member of the Mycobacterium tuberculosis complex. Transmission of tuberculosis is majorly through inhalation of infected aerosols released from the cough, sneeze, and talkings of an infected person. Tuberculosis, by statistics, has been shown to affect about one quarter of the world's population. That's latent tuberculosis. About one quarter, which is about 2 billion people, it has been suggested by statistics to have latent tuberculosis, but only about 5 to 10%, which is just a small proportion, advances or progresses into active disease. Tuberculosis is strongly associated with HIV co-infection, malnutrition, poverty, and poor accessibility of healthcare facilities. Nonetheless, effective diagnosis, preventive strategies, and implementation of proper treatment regimen has made tuberculosis both a preventable and curable infectious disease. Let's talk about the causative agents. The causative agent of tuberculosis is the Mycobacterium tuberculosis. That's the primary causative agent. And this Mycobacterium tuberculosis belongs to a group of bacteria known as the Mycobacterium tuberculosis complex. This Mycobacterium tuberculosis complex contains other bacteria that are also capable of causing tuberculosis. Examples of such bacteria include Mycobacterium bovis, M. bovis, Mycobacterium bovis. This majorly causes tuberculosis in cattle, but it can also cause tuberculosis in humans as well. We also have Mycobacterium africanum. As the name implies, Mycobacterium africanum, this causes tuberculosis in Africa, especially in West Africa. We also have Mycobacterium microti, Mycobacterium caneti. These all cause tuberculosis, but the major culprit in causing tuberculosis is Mycobacterium tuberculosis. Mycobacterium tuberculosis. So what are the key characteristics of Mycobacterium tuberculosis? First of it is acid fastness. Mycobacterium tuberculosis is acid fast. This is majorly because of the presence of a high mycolic acid content in its cell wall. This high mycolic acid content makes it to resist decolorization in during its staining, thus making it to retain the primary stain, which is carbofuran in Xenacin staining technique. Also, the Mycobacterium tuberculosis is slow growing in the sense that it attains its generation time in about 18 to 24 hours, and that's incredibly slow when compared to other bacteria that reach their generation time in seconds to minutes. Also, Mycobacterium tuberculosis is an aerobic organism, meaning that it has affinity for oxygen, and that probably explains why tuberculosis affects the lungs, which happens to be the oxygen-rich center of the body. Also, Mycobacterium tuberculosis is also very resistant to intracellular killing, and that makes it to resist the activities of alveolar macrophages. As we go into the pathogenesis, we'll understand how that happens. Mycobacterium tuberculosis is acid-fast, slow-growing, non-motile, non-spore forming, and rod-shaped bacteria. These characteristics contributes immensely to its virulence, to its resistance to eradication, and also to its long-term treatment requirement. Let's talk about the pathogenesis. The pathogenesis of tuberculosis is basically the interrelationship or the activities that happen between the bacilli, that's in this case Mycobacterium tuberculosis, and the host immune system. Tuberculosis usually enters into the host immune system, into the host, that is the infected person, through inhalation of aerosols that contain the in the bacilli, which is Mycobacterium tuberculosis in this case. When the bacilli enters, is being inhaled, it passes through the respiratory tract and enters into the lungs. In the lungs, what happens is that the alveolar macrophages present in the lungs engulf the bacilli. They engulf the bacilli. So we have this. So we have this, right? Yeah, we have this. Okay, let's say this is the lungs. Follow my diagram. I'm not very good in drawing. Yeah, this is the lungs, right? So the bacilli passes through the respiratory tract and then enters the lungs. Let's say this is the Mycobacterium tuberculosis. It enters the lungs. In the lungs, the alveolar macrophages engulf the bacilli. So these are the macrophages. Let's say this is one macrophage. It engulfs the bacilli. But something really striking happens. Normally, alveolar macrophages usually eliminate and neutralize pathogens by something called the phagolysosomal fission. The phagolysosomal fission is a mechanism in which alveolar macrophages exterminate and neutralize pathogens. But in the case of Mycobacterium tuberculosis, Mycobacterium tuberculosis inhibits this phagolysosomal fission. Let me explain how the phagolysosomal fission occurs. So let's say this is a pathogen, right? So this is a pathogen. Alveolar macrophages engulf it. Let me say these are macrophages. This is macrophage. This is a macrophage. The macrophage engulfs the bacillus. Let's say this is a bacterium. The macrophage engulfs the bacteria, and when it engulfs the bacteria, it forms something called a vesicle around that bacteria it has engulfed, right? It forms a vesicle around it. It forms a vesicle, and this vesicle is called a phagosome. A phagosome. A phagosome is basically the vesicle in which the macrophage engulfs the bacteria within itself. It's also important to note that within the macrophages you have lysosomes, and lysosomes have digestive enzymes which have the capability of neutralizing pathogens. So the macrophage goes ahead to make an opening in this phagosome, and this opening enables the entrance of lysosomes. And so When these lysosomes penetrate into the phagosome within the macrophage, they neutralize the pathogen, in this case, a bacteria. It happens for viruses, happens for fungi as well. So this is the phagolysosomal fission. Phagolysosomal fusion. This is a phagolysosomal fusion. But in the case of Mycobacterium tuberculosis, it inhibits this entire process of phagolysosomal fusion. And as such, it gets really dangerous, right? It gets really dangerous because if the alveolar macrophages cannot eliminate the bacteria through the phagolysosomal fusion, it means that the bacteria cannot easily replicate and dominate the lungs, causing multiple infections and even extrapulmonary tuberculosis. But the immune system does something. It does something. It aggregates other immune cells. Let's say this is the bacilli now within the lungs, and the macrophage has engulfed it, but it cannot use phagolysosomal fission to exterminate it. What happens is that the immune system senses this and it recruits more cells to this site. So more cells gather here. So this is the macrophage, right? So have more cells around. The immune system triggers more cells to come to that site of infection in order to do what? In order to contain the infection, since the alveolar macrophages cannot neutralize it. And some of those cells that come into play or that are being recruited by the immune system to the site of infection are, we have more macrophages, of course, and then epithelioid cells, epithelioid, epithelioid cells, epithelioid cells, epithelioid cells. Then also, there are also Langer's giant cells, giant cells. Also, lymphocytes as well. So the immune system triggers the release of these cells to the site of infection. And when these cells aggregate to this site of infection within the lungs, this aggregation is called a granuloma. Granuloma. It's called a granuloma. And granuloma formation is basically the hallmark of tuberculosis infection. What does this granuloma do? The granuloma helps to contain the infection, to localize the infection, such that the bacillus doesn't spread to or doesn't utterly destroy the lung parenchyma, or doesn't even enter into the bloodstream and spread to other parts of the body, causing multiple and more severe infection. So the granuloma is formed to help contain the infection. So when this granuloma gets formed, the individual most times don't even know he has tuberculosis, right? Because it doesn't exhibit the signs and symptoms that are peculiar to tuberculosis. This stage is known as the latent tuberculosis infection. Latent because it's existing but is not really showing signs and symptoms. But something happens if this particular individual gets immunocompromised. Maybe it comes down with HIV infection, chronic renal failure, diabetes, as the case may be. What happens is that the bacteria becomes reactivated. This bacteria here becomes reactivated and it begins to increase its replication. And this increase in replication causes lung tissue destruction due to cautious necrosis, due to cavitation, due to fibrosis. In some advanced cases, it even leads to extrapulmonary tuberculosis, in which the bacillus, in this case Mycobacterium tuberculosis, enters into the bloodstream, affecting the lymph nodes, affecting the bones, causing port disease, affecting the gastrointestinal tract, affecting the kidney, as well as the central nervous system, causing meningitis. Also, severe forms such as miliary tuberculosis also occur when the bacillus enters into the bloodstream. So basically, this is the pathogenesis of tuberculosis. So let's talk about the epidemiology. Tuberculosis is of global public health importance. Tuberculosis is one of the major infectious killers worldwide. About a million get ill with a very high mortality rate, especially in regions with low and very poor accessibility to facilities, to healthcare facilities. Also, like I said earlier, about one quarter of the world's population is said to have latent tuberculosis infection, but only a small proportion, about 5 to 10%, advance or progress into um, active disease of tuberculosis. Tuberculosis majorly affects the regions of the world such as Africa, Southeast Asia, and the Western Pacific regions. So, what are the risk factors that predispose an individual to developing tuberculosis infection or to progress from a latent tuberculosis infection to an active disease of tuberculosis? One of such is immunosuppression. Immunosuppression usually occurs or usually causes the progression of latent tuberculosis infection into advanced or active phase of tuberculosis infection. Coming down with, most importantly, HIV. HIV have a strong correlation with tuberculosis. Coming down with HIV, chronic renal failure, um, malnutrition, diabetes mellitus, and prolonged use of immunosuppressive drugs such as corticosteroids and anti-tumor necrosis factor drugs all predispose an individual to progress from latent tuberculosis infection into active disease of tuberculosis. Also, there are environmental and social factors such as living in overcrowded regions, living under homelessness, incarceration, poor or low socioeconomic status all contribute to getting infected with tuberculosis. Also, there's also behavioral factors such as cigarette smoking, alcohol abuse, and substance abuse generally weaken the immune system and cause progression of latent TB to active disease. Also, there is also age. Younger children and older adults have a weakened immune system, and as such, they cannot really withstand or make this granuloma phase to persist over time, and so the immune system becomes weakened, right? Advancing from a latent infection into active disease of tuberculosis. So, how is tuberculosis diagnosed? The first form of diagnosis of tuberculosis is clinical evaluation via a clinician or a physician. And the clinician or physician usually checks out for signs and symptoms that are peculiar to tuberculosis. Examples of such signs include coughing that lasts more than 3 weeks, also chest pain or angina, hemoptysis, that is coughing out or expectorating blood during cough sessions. Other symptoms include unexplained weight loss, night sweats, fever, etc. And more symptoms also come into play depending on the site of infection in cases of extrapulmonary tuberculosis. Another form of diagnosis is laboratory diagnosis. In laboratory diagnosis, there is the use of microscopy, that is the use of Xenicin staining technique to detect the presence of acid-fast bacilli. Also, the use of fluorescent staining, the use of rhodamine or amine is also used, and it is said to be more sensitive than the Xenicin staining technique. Also, there is the use of culture techniques. Culture is actually the gold standard for diagnosing tuberculosis, Mycobacterium tuberculosis. Culture is done on the Lowenstein-Jensen media, which is a solid media for isolating Mycobacterium tuberculosis. Also, culture is also done using the MGIT, which is the Mycobacterium growth indicator tube. And this growth indicator tube is a liquid medium, and it is said to have it has the advantage rather over the Lowenstein-Jensen media because it causes a faster, a more rapid isolation of Mycobacterium tuberculosis. There's also the use of immunological tests such as the tuberculin skin test and such as the interferon gamma release assays. Also, there's the use of molecular tests, molecular techniques using the GeneSPAT The genus part detects a TB DNA and also checks for rifampicin resistance as well. Also, there's the use of Lyme probe assays as well as nucleic acid amplification tests. So these are basically the methods used to diagnose tuberculosis or Mycobacterium tuberculosis infection. So what are the ways in which Mycobacterium tuberculosis or tuberculosis can be prevented and controlled? One of the most important ways is through vaccination. Vaccination is done using BCG. BCG. BCG stands for Bacil Camel Guerin. This is a vaccination that is used for tuberculosis, and it usually provides protection for children, mostly for severe forms of child tuberculosis, such as meningitis and miliary tuberculosis. But the BCG doesn't usually, it provides just a limited protection in cases of adult pulmonary tuberculosis. Also, as part of the prevention and control measures, there's also infection control measures, and that includes proper ventilation of healthcare settings and overcrowded regions, and also respiratory hygiene and coughing etiquette. This is particularly important to those already infected with tuberculosis infection. It is advised for them to cough into the airbowl as opposed to coughing into the direct atmosphere, releasing infected droplets that can be inhaled by healthy individuals, leading to rapid or more transmission of the infection. Also, as part of the prevention and control, there's also pasteurization. Milk should be properly pasteurized in order to kill any form of Mycobacterium bovis that is present that can lead to tuberculosis. Those are basically, and also there's also social intervention, including improving nutrition, alleviation of poverty, and reducing overcrowding. This helps in handling and militating against tuberculosis. Let's talk about the treatment of tuberculosis. The treatment of tuberculosis is long term, lasting about 4 to 9 months, depending on the particular case. And it involves the use of multiple drugs in order to prevent the tendencies of resistance. The treatment involves two phases, including the first stage, which is the intensive phase, and the second phase, which is the continuation phase. The intensive phase lasts for about 2 months, and it involves the use of drugs such as isoniazid, rifampicin, pyrazinamide, as well as ethambutol. And the second phase, which is the continuation phase, lasts for about 4 months, and it involves the use of isoniazid and rifampicin drugs.